Hello and welcome to Delta Cast Tutorials. My name is Lindsey, and today I'll be demonstrating a boxer cast using the functional cast therapy technique. This cast will be used for injuries to the 4th and 5th metacarpal and the 4th and 5th proximal phalanx injuries or physician prescribed. Now let's get this patient in position. We're going to get the wrist in 15 to 30 degrees of extension, the metacarpal phalangeal joints, 45 to 90 degrees of flexion, or as prescribed by the provider, and ensuring the fingers are side by side. Lastly, the bony prominences are padded and comfortable. Now we're going to add the Delta TerryNet thumb spica stockinette. First, roll it up to don easier and place it on the patient's hand and continue to roll it down. Next, we're going to determine where to place our padding on the extremity for more comfort. All the bony prominences that we need to pay attention to, such as the PIP joint, metacarpal phalangeal joint, radial styloid, ulnar styloid, and pisiform area, so cut small pieces of the Delta TerryNet adhesive foam and place on the needed areas. Place the zip stick on the non-affected side of the hand or where you plan to cut the cast open. Slide in the zip stick as delicate as possible and reposition the patient. Ensure the zip stick is on the 1st and 2nd phalanges. I'm going to ensure that we add padding on the bony prominences on the 4th and 5th metacarpal heads area. Again, ensure the zip stick is not on the 4th and 5th metacarpal area. Don your gloves to protect your hands. We're going to be using Delta Cast conformable cast tape. It's a fabulous polyester cast tape with a 3-way stretch, allowing for radiolucency and semi-rigidity for donning and doffing the cast easier. First thing we want to do is make our fan folded layers, starting with at least 2 fan folded layers or more layers if needed for strength. Palpate where the distal end of the fingers is located, noting how distal you want the splint to go, and place the layers accordingly. To allow for more time to mold and contour the cast to the extremity, you can forego activating the fan folded layers with water and only activate the remaining cast tape roll. Dip and saturate the roll in room temperature water for at least 3 seconds. Squeeze the roll gently and leave some water in the roll to slow down the cure time if you are new to this technique. Start at the fingers, ensuring that the fingers lie flat. Here's a pearl that can help. You can buddy tape the fingers with medical tape to ensure they stay side by side, but do this prior to applying the stockinette. Continue applying the cast tape and work your way proximal. Ensure that you are using a 50-50 method to apply 2 layers of cast tape everywhere you go. Smooth out the fan folded layers as you move proximal. Again, use the 50-50 method to ensure good coverage and no major gaps. Next, add more water to your gloves if the cast is too tacky or sticky. This will allow you to better laminate the cast tape. Adjust your zip stick to ensure it hasn't migrated from the original position. Lamination will allow those layers to mesh together to make the cast more strong. So now we're going to reposition the patient again, get that extension back at the wrist and flexion at the metacarpal phalangeal joints. Also keep the proximal interphalangeal joint straight. Keep laminating by rubbing the cast until it holds its shape and is more cured. This will take 3 to 5 minutes, depending on the temperature of water you had. And also this depends on how much water you squeezed out of the cast tape. Keep laminating the cast to ensure strength and maintain the patient's position. So we're going to trim the area around the thumb and expose the second and third metacarpal area. Depending on the patient's individual diagnosis and how much stability you want to maintain, you can expose more. Now that the cast is set but not fully cured, it will still hold its shape. Go ahead and mark the areas where you want to remove unneeded material. There are different ways you can allow for more exposure or stabilization. Do your markings accordingly, but for this occasion, we're going to just take out the areas where the index finger and long finger are and make a teardrop around the thumb and remove all of that material. Again, you can take out more if needed. Let's add our Delta Terry Net adhesive hook. Cut as many straps as you need. You need at least 4 hook tabs for these types of casts. I prefer to round the ends to increase adherence to the cast surface. Another pearl you can do is use a medical heat gun to heat up the adhesive backing to make them stickier on the cast surface. Touch only a small corner of each hook tab. Try your best not to continually touch the adhesive portion of each hook tab. This reduces the tackiness on the surface of the tab. You can add a 2-inch hook around the wrist area in lieu of a 1-inch hook. So it's a clinical preference. I prefer 2-inch because it provides a little bit better coverage for stability. Now let's cut along the zip stick. And as we move down, bow the cast by squeezing it gently with the other hand to allow more space for the scissors. This allows for an easier cut. Take the zip stick out gently and remove the cast off the patient, and we're going to trim the areas that we marked earlier. And I'm just showing you here, you can cut it or place the zip stick in different areas, depending on if they have pins, things where you don't want them to supinate or pronate their wrist. I elected to change out the 1 inch and add a 2-inch hook around there for better wrist coverage and immobilization. The preference of the hook and loop is the clinician's preference. Gently allow the patient to slide out of this cast. Trim out the unneeded material and curve the corners. And what we're going to do also is take out 1/4 of an inch out of the middle of the cast so that it doesn't squeeze the extremity. Now, of course, I'm still trimming the marked areas, but around the forearm areas where we want to trim some extra width out of it. Some areas I was conservative about cutting because I didn't want to cut too much off of it. I will fit the cast on the patient first to ensure that I'm correct with the exposure. Now that I have the splint mostly trimmed up, this is the area around the thumb that you can alternatively remove to have more range of motion in the whole thumb area. Now let's fit this on the patient to see where we stand with exposure. Gently place this on the patient's extremity. Ensure that on the volar and dorsal side we have enough exposure for range of motion of the unaffected fingers, i.e. the 2nd and the 3rd finger. So I'm going to cut some more of those areas and make sure that the range of motion is really good, especially around the thumb. And that is up to the clinician in what range of motion you want the patient to have. Now we're going to add the Delta Terry Net Fleece Edger. I like to start on the straightaways where I can get it started a little bit easier, applying half of the width on the outside and half of the width on the inside. Once I get to a more curvier area, I'll lay the fleece edger down first and then cut it off. Continue with this same technique. This can be kind of fun to do when you're dressing your cast up. Again, I like to pull off the adhesive backing and then tack it down to the end termination point. Then lay everything down. Lay the curved areas of the fleece edger down first. This technique decreases wrinkles. Then smooth the rest of the fleece edger down. Now I like to pedal the fleece edger on areas that's hard to go around, like around the top portion where the pinky and ring fingers are and around the thumb. This makes it a little bit easier when you apply this portion. This is going around the thumb using the pedaling technique. Just get that and go all the way around, and then you can individually lay things down so it can decrease the wrinkles from occurring. Lastly, finish up the cast with the fleece edger. Now, I want to show you an alternate way you can cut this or modify it. Just cut out the whole area around the thumb and now just have the forearm and injury area in the cast. And this is how it will look. Now that we have this cast on the patient, go ahead and add the loop on. Add your loop to all the adhesive hooks, and then we're finished. This is the boxer cast using the functional cast therapy technique. Thank you.